This episode is brought to you by Shopify. Whether you're selling a little or a lot, Shopify helps you do your thing, however you cha-ching. From the launch your online shop stage, all the way to the we just hit 1 million orders stage. No matter what stage you're in, Shopify's there to help you grow. Sign up for a $1 per month trial period at shopify.com/special offer, all lowercase. That's shopify.com/special offer.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in nursing school and at the bedside. Today, we're taking a dive into pharmacology, looking at oral anti-diabetic medications. Before we do that, let's take a quick minute for our listener shout out to Missy, who says this. I've been a nurse for 11 years, and I have been listening to this podcast on the regular since I discovered it. I love that it brings me back to the basics, and let's face it, even after nursing as long as I have, I still learn something new each time I listen. Thanks, Nurse Mo. Well, thank you, Missy. I agree. As nurses, we are always and forever students because we're always and forever learning. So I'm glad that you're finding value in listening to the podcast. And I just want to thank you for sharing your experience. And I hope you're doing well. All my best to you in your continued awesome career as an awesome nurse. All right. Are you ready to dive into oral anti-diabetic medications? All righty. So many patients with type 2 diabetes take oral anti-diabetic medications, either as monotherapy, meaning maybe they take that medication and also adjust their diet and their lifestyle to treat their type 2 diabetes. Or in a lot of cases, they take it in conjunction with maybe another oral anti-diabetic medication or insulin. It's really important that you are able to recognize these medications as their use increases the risk of hypoglycemia in most cases. And that risk for hypoglycemia is going to go up significantly if the patient is also taking insulin. So in this episode, I'll cover the oral antidiabetic medications and give a brief overview of each one with a few key things to know. One very, very, very important thing to remember about these medications is that they are not used for type 1 diabetes. They are only used to treat type 2 diabetes. So the first drug class we'll talk about are the sulfonylureas, and an example medication in this class is glipizide. So sulfonylureas, like glipizide, work by binding to potassium channels in the pancreatic beta cells. And what this does is it leads to more insulin secretion. So right away, I hope you're thinking, this sounds like there's a risk for hypoglycemia. Yes, there definitely is because of that increased insulin secretion. So you want to be very aware of that if your patient is taking a sulfonylurea like glipizide. This medication is taken 30 minutes before breakfast. So a very important patient teaching component is to teach your patient to hold their dose if they're not able to eat breakfast. Maybe they're not feeling well or they're nauseous, so they're not eating breakfast, or they need to go in and get their lipid panel drawn and they have to fast for that. So you wouldn't want them taking their glipizide and not eating their breakfast. The most common side effect of glipizide is, in addition to hypoglycemia, of course, is photosensitivity. So another teaching component is to teach patients to wear protective clothing, such as long sleeves or a hat, as well as sunscreen to avoid a photosensitivity reaction. They should also avoid drinking alcohol while taking this medication, as this can cause a disulfiram-like reaction, which involves abdominal cramping, headache, flushing, nausea, and hypoglycemia, and it's very, very unpleasant. So that is your brief overview of the sulfonylureas like glipizide. A key thing to know about sulfonylureas is that Medications in this class are going to increase the risk of hypoglycemia when other oral antidiabetic medications are used and if insulin is being used. All right, let's move on now to the Biguanides. And our example medication here is metformin. So metformin works by decreasing hepatic gluconeogenesis and lipogenesis, while also increasing the uptake of glucose in muscles. Metformin does not cause hypoglycemia on its own, but hypoglycemia can still occur when the medication is taken along with insulin or a sulfonylurea like glipizide. Now, the most troublesome and common side effects with metformin are GI related and include bloating, nausea, vomiting, and diarrhea. The effects can be reduced by taking the medication with meals, so that's a key thing to teach your patient. A very, very important thing to remember about metformin is that the medication is held for about 48 hours if IV contrast is used, because this combination puts the patient at high risk for contrast-induced nephropathy. So if you've got your patient who has abdominal pain and they're going down for a CT scan with contrast to figure out what's going on with their abdomen, you need to be aware if they take metformin so that you can remind the physician and advocate for holding this dose after that contrast is delivered so that the patient doesn't suffer kidney injury. So your key thing to know about metformin is avoid use with IV contrast. The next drug class we're talking about are the Meglitinides, and the medication we're going to be using as our example is repaglinide. These medications work by increasing insulin secretion in pancreatic beta cells. And now, since I said that, what are you thinking? What are the alarm bells doing? Are they going off thinking, oh my gosh, high risk for hypoglycemia? Then yes, gold star for you. That's exactly what happens with this medication. So that is the most common and serious side effect of repaglinide. And this can be compounded if the patient is taking other medications that increase serum levels of this medication, such as NSAIDs, hormonal contraceptives, beta blockers, and clopidogrel. There are a bunch others. So I would say if you have a patient who's taking repaglinide, be very watchful for adverse drug reactions. Go and look up what it interacts with and what can cause increased serum levels of repaglinide, because if their serum levels are increased, what do you think this does to the hypoglycemia risk? It goes way up as well. Repaglinide is taken up to 30 minutes before meals in 2 to 3 doses per day. So your key thing to know about repaglinide is high risk for hypoglycemia. Next up, we have DPP4 inhibitors. An example drug is sitagliptin, which you might recognize by the brand name Januvia. So sitagliptin and other DPP4 inhibitors work by inhibiting an enzyme that leads to increased levels of active incretin hormones, which play a key role in glucose homeostasis. The result of this is increased insulin release and decrease in glucagon. While hypoglycemia can occur with sitagliptin, it's more likely to occur if the patient is also taking insulin or a sulfonylurea like glipizide. Serious adverse reactions include pancreatitis, heart failure, and rhabdomyolysis. Teach your patient the signs of these conditions because they would need to seek medical help very quickly. So signs of pancreatitis would include nausea, vomiting, and severe abdominal pain. Signs of heart failure are edema, rapid weight gain, and shortness of breath. And rhabdomyolysis causes muscle pain, weakness, and dark urine. I'll say those again. Signs of pancreatitis include nausea, vomiting, and severe abdominal pain. Signs of heart failure are edema, rapid weight gain, and shortness of breath. And rhabdomyolysis causes muscle pain, weakness, and dark urine. So your one key thing to know about sitagliptin is that there are some serious side effects that can occur with this medication. They include pancreatitis, heart failure, and rhabdomyolysis. Before we move on to talk about alpha-glucosidase inhibitors, because I know you can't wait for that, let's take a quick minute for a break, and then we'll come back and we'll continue our discussion about oral antidiabetic medications.
This episode is brought to you by Shopify. Whether you're selling a little or a lot, Shopify helps you do your thing, however you cha-ching. From the launch your online shop stage, all the way to the we just hit 1 million orders stage. No matter what stage you're in, Shopify's there to help you grow. Sign up for a $1 per month trial period at shopify.com/special offer, all lowercase. That's shopify.com/special offer.
So looking at alpha-glucosidase inhibitors, our example drug here is acarbose. Acarbose works by inhibiting an enzyme in the GI tract, and this leads to slowed glucose absorption and a reduction in postprandial glucose levels. Postprandial means after a meal. Acarbose is administered 3 times per day with the first bite of each meal. For some reason, that is always on exams, with the first bite of each meal. Common side effects include flatulence, diarrhea, and abdominal pain. Now, while acarbose does not cause hypoglycemia on its own, hypoglycemia risk is increased when taken along with insulin or a sulfonylurea like glipizide. A very important thing to know about acarbose is that hypoglycemia must be treated with IV glucose, IM glucagon, or oral glucose like glucose gel, glucose liquid, or glucose tablet, because the medication itself is going to prevent that breakdown of sucrose. So you couldn't give jelly or honey or table sugar to this person, or maybe some orange juice, because it's not going to be effective due to how this medication works. So your key thing to know about acarbose is if hypoglycemic, give glucose gel. Our next drug class are the SGLT2 inhibitors. These are canagliflozin, which goes by the much easier to say brand name Invokana, and empagliflozin, which goes by the brand name Jardiance. Now, there are others, but it seems like Invokana and Jardiance are the most popular. So these medications work by inhibiting renal tubular sodium glucose cotransporter 2. That's that SGLT2 component. And what this does is it inhibits glucose reabsorption and causes increased excretion of glucose in the urine. So all this action is happening in the kidneys. Note these medications can cause hypoglycemia on their own, and the effects are increased if other anti-diabetic medications are being taken. In addition, note that patients taking a diuretic or an antihypertensive or both are going to be at much higher risk for hypotension while taking an SGLT2 inhibitor. And that's because the medication could cause increased urine output. And then if they're on a diuretic, that's going to cause even more increased urine output. And when we have fluid volume losses, we have hypotension. So that's why they would be more at risk for hypotension if they're taking a diuretic. And then, of course, that's going to be compounded if they're taking an antihypertensive medication. Because of the presence of glucose in the urinary tract and in the urine, these patients are also at higher risk for UTI, which in severe cases can lead to sepsis. UTI is one of the most common causes of sepsis and septic shock. Teach patients the signs of UTI, which include urinary frequency and pain with urination. And because this medication can cause increased urination and volume depletion, teach your patient to stay hydrated, unless, of course, they are on a fluid restriction because they're taking a diuretic. You also want to teach them to change positions slowly and to report signs of hypotension, such as fatigue, dizziness, or feeling faint. This medication is taken once each morning with or without food. Your key thing to know about Invokana and Jardiance and other SGLT2 inhibitors is there's high risk for urinary tract infection. Now, our last medication, I've not really seen it used that commonly, but you could possibly see it, and that is bromocriptine, which is a dopamine agonist. And this is a really interesting medication because it comes in two formulations. One is used to treat Parkinson's disease, and the other, which is called Cycloset, is used in type 2 diabetes. And it works by increasing insulin sensitivity, which reduces fasting and postprandial blood sugar levels. The most common adverse effects of Cycloset are orthostatic hypotension, dizziness, drowsiness, and nausea. And be aware that the sedating side effects, dizziness, drowsiness, those kinds of things are going to be compounded if the patient is taking another medication that causes those side effects, like a CNS depressant. Of course, hypoglycemia can occur, especially when taking other anti-diabetic medications. Cycloset is taken each morning within 2 hours of waking and should always be taken with food. So your key thing to know about Cycloset is to assess for hypotension. So we've talked about this a lot throughout this review, talking about hypoglycemia. So I just want to review very quickly the signs of hypoglycemia. So those are things like sweating, tremor, irritability, really intense hunger, dizziness, tachycardia. The patient may say they feel palpitations, and anxiety. So if your patient is exhibiting these signs, then you know, they're probably having a hypoglycemic reaction. Their blood sugar is probably low. I'm going to check their blood sugar and I'm going to increase their blood glucose by giving them some kind of carbohydrate. And if they're taking acarbose, that's going to be glucose gel or glucose liquid or maybe IV glucose. We're not going to give them, the cup of orange juice or the packet of sugar because that's not going to work on them. So again, signs of hypoglycemia: sweating or diaphoresis, tremor, irritability, hunger, dizziness, tachycardia or palpitations, and anxiety. And then one more quick little thing I want to share with you is an easy mnemonic to help when you're taking care of patients taking these medications, so that you're thinking along the lines of the key things you need to be watching out for. So the mnemonic is ORAL, oral, for oral antidiabetic. O stands for, this is only for type 2 diabetes. R stands for risk for hypoglycemia. A stands for ask. Ask about other anti-diabetic meds. Why do we want to do that? Because of the risk for hypoglycemia. And then L is the labs you're going to check. You're going to be following glucose, obviously, A1C, and in a lot of cases, liver and renal labs. Now, I didn't mention this as I was talking about each medication because I didn't want to overload you with too many details. We could have talked for 30 minutes about each one of those. I wanted to just give you the highlights, but many of them affect liver function and can affect renal function. So you want to monitor those labs. Be aware if your patient has liver impairment or renal impairment. If they're taking these medications, that it could cause issues for that patient. So again, that was ORAL. O means only for type 2 diabetes. R is risk, which is risk for hypoglycemia. A is to ask. Ask about other anti-diabetic meds. And L is the labs: glucose, A1C, and your liver and renal function tests. So there you have it, your quick overview of oral anti-diabetic medications. If you like learning about pharmacology in an audio format, then you've got to check out my online audio-based pharmacology program, Fast Pharmacology. It involves me teaching you pharmacology concepts in 5 minutes or less, including foundation concepts, as well as about 80 different drug classes. So that's available in podcast form. It's available online if you prefer to do it that way. And there's even some quizzes to help you test your understanding. So again, that is Fast Pharmacology. I'll put a link in the episode notes, or you can just go to straightanursingstudent.com/fast to check it out. And if you're not yet following the show, make sure you do that so you never miss an episode. And I'd love if you'd take a minute to leave a 5-star review to let me know how the podcast is helping you be an even more awesome nursing student or awesome nurse. I'll see you next week. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
At a time when change is constant and we are pulled in far too many directions, we need a way to stay present to life and to increase our ability to remain calm, think clearly, and maintain our well-being. Many studies indicate mindfulness improves our mental, emotional, and physical health. On A Mindful Moment with Teresa McKee, you can learn how to practice mindfulness and enjoy its many benefits. Tune in for guided meditations and to hear tips and advice from some of the most respected experts in the fields of mental health and mindfulness. The world truly can be a better place. It all starts with a mindful moment.